Am I audible?
Yes,
Yes,
are.
Gayatri, you are audible. Yes.
Okay. Good day to all. Welcome to the second ISCLR webinar on contemporary legends and pandemic lore, conducted in association with Sree Vidyapeetom College and Center for Urban Studies, Mahatma Gandhi University, Kerala, India. The moderator for today's session is Theo Meadow. On behalf of the webinar committee, I cordially invite Theo to take over the session. Welcome, Theo.
Yes, thank you. And glad you made this introduction. So I start the same way as I started yesterday. Good evening, India. Good afternoon, Europe. And good morning, Canada and the United States. Welcome all to the second day of the second webinar on contemporary legends and pandemic lore, organized by ISCLR, the International Society of Contemporary Legend Research, and the whole webinar team of the Mahatma Gandhi University. My name is Theo Meadow. I am a folk narrative researcher at the Mertens Institute in Amsterdam and a professor at the University of Groningen, the Netherlands. Apart from that, I am the president of ISCLR at the moment. And this year I started to organize webinars like these. So we have had an interesting day of presentations yesterday. Remember, this was all organized in just a month or so, and the result is remarkable. Thanks to Anoop and Matthew and the entire webinar team. I will be the moderator of today, and the program of today looks very promising with Ben Radford, John Bodner, and myself. As soon as we start, please remember to mute your microphones to avoid background rumble. Please put your questions and remarks in the chat so we can have a look at them later on. So now, without further ado, let's start with the first speaker of today, Benjamin Radford, who is a famous American journalist, author, and folklorist. Yes, you are. He very regularly appears in the media, publishes a lot of articles, and if I mention the titles of some of his books, you will understand where his investigations lead. Scientific Paranormal Investigation, Tracking the Chupacabra, Bad Clowns, and Investigating Ghosts. Today, however, Ben will be talking about folklore and public health, partners in mitigating medical misinformation. Ben, the microphone and screen are yours now.
Thank you, Theo and Matthew and everybody. This is a treat. It's unfortunately during pandemic times, this is what we can do. But I'm very impressed and honored to be part of this this program that's pulled together in such short time. So with that, I will jump into it and share my screen if my computer will allow me to. Just a minute here. Sometimes it's a little tricky because why make things easy? Oh, there we go. Okay. All right. So, assuming that everybody can see this, I will jump into it. So, yes, one thing that Theo didn't mention, because I haven't really mentioned it publicly, is that I am a student in public health, and so this is a particular interest of mine. And so I've always been interested in looking at the ways in which we can find interdisciplinary approaches that look at, like, for example, public health, epidemiology, folklore, medical anthropology, and things like that, bringing them together to better address problems. So I'm going to sort of give an overview of the problem and some of the folkloric perspectives that can be brought to public health and pandemics particularly. So the most obvious manifestation of pandemic lore and COVID is, of course, the current infodemic. And of course, digital disinformation is a widely recognized threat to public health, with unprecedented amounts of misinformation appearing online. And it's been interesting as a journalist and folklorist and researcher to see just how widely appreciated that is these days. Among folklorists, this is not news. This is, you know, many of us, many people watching right now have studied this and researched this, and Teo has done this, and you know, there's lots of different narratives. Andrea Akita, John Lee, Diane Goldstein, and many others. But from a public health perspective, this is sort of a surprise to me, and I'll talk about that in a second. So, so for the first time, probably in decades, if not history, the powers that be are having a sort of come to God moment, if you will, realizing that misinformation, particularly circulating in narratives and rumors and conspiracy theories, is in fact affecting public health problems, including vaccine hesitancy and so on. So in his very first advisory, Surgeon General Murthy issued a warning that, quote, health misinformation is a serious threat to public health. We can and must confront it together. The head of the World Health Organization said also, we're not just fighting an epidemic, we're fighting an infodemic. So this is, again, a high profile recognition that there are parallel tracks between epidemiology and folklore. I'm just going to touch on a couple of quick items regarding the pandemic lore specifically. One of them is, again, there's a renewed focus on pandemic lore. And so public health officials are used to seeing epidemiological models to track the spread of infectious diseases, right? This is where you see you see the chart. You have, you know, we have an index case, an origin case, for example, Zika or Ebola or polio, what have you, and then they track and spread these things out. And of course, you can apply a very similar folkloric process. And some people, such as Tim Tangerlini, who I'll talk about a little bit later, have done so. And so again, I'm trying to establish and sort of reinforce to both sides just how useful a combination of these two can be. Probably the most famous or infamous case of pandemic misinformation occurred about a year and a half ago, when in May 2020 there was a 26 YouTube video released titled "Plandemic." And I actually gave talks on this at a previous ISCLR conference, so I'm not going to go into it too much. But basically, this was one of the higher profile examples of a conspiracy theory narrative being spread widely in service, as it turns out, of promoting a book. And it was a low budget, slickly produced video, mainly an interview with this person here on the right-hand side, Dr. Judy Mikovits, who made a wide variety of claims, again, in 26 minutes, ranging from accusing Dr. Fauci of misconduct to claiming she was personally persecuted, spreading conspiracy theories about vaccinations and so on. And as it turned out, again, sort of as the story unfolded, it later became apparent that the whole video was in fact a sort of stealth publicity stunt video promoting her book titled "Plague of Corruption," which, as a result of this misinformation, not only increased vaccine hesitancy, certainly, but also, of course, made her very wealthy with her book. So that was one of the problems there. Let's see here. Oh, there we go. So in an October 2020 article published in the Harvard Kennedy School of Misinformation, it actually recognized that in fact this was one of the pandemic video was one of the drivers of vaccine hesitancy. They said, quote, anti-vaccine activists produce pandemic to increase vaccine hesitancy and decrease vaccination. But really the lasting impact they say is promoting cynicism among the public about public health measures, which of course can be dangerous, especially during a pandemic. And in addition to this, there's another case which I investigated to some extent, and these were the COVID party rumors. And there earlier versions of this were the bug chasing rumors that circulated in the 1980s with the AIDS HIV epidemic. But this particular version circulated last July. And again, I'm not going to go into the whole thing, but just sort of giving you an overview of some of the other ones, where there were stories of people who were getting together to intentionally infect themselves with COVID with the idea of inoculation. And there was one particular woman, chief medical officer at a hospital in Houston who claimed to have overheard a dying patient saying, "I wish I hadn't gone to that COVID party." And of course, this made national news because it seemed to reinforce the notion there were these sort of underground liminal conspiracies of people who are trying to not only get themselves infected but potentially others. However, if you watch the video more carefully, you realize that she's in fact relating a folk tale. She admits that while she didn't personally hear it, it was a friend of a friend, someone else in the hospital. So again, to mainstream journalists, this was and others, this was evidence that these were going on. To folklorists, it was pretty clear what was going on. But I want to zoom out to the bigger picture. So, COVID misinformation, it's only the most recent and highest profile example of this. But of course, there's nothing new, as I mentioned. You have doctors being distrusted in West Africa who are trying to stamp out the Ebola virus. You have vaccine hesitancy that I talked about. You have conspiracy theories about 5G in vaccines and causing infertility and things like that. And education has always been a core goal of public health, but effectively addressing it is going to require a more interdisciplinary approach, including folklore, medical anthropology, and journalism. So that's one of the problems. And so I want to talk just briefly about what's the harm, because that can sort of be that's one of the common questions. Okay, well, is there some empirical concrete evidence of some harm being circulated? And of course, the answer is yes. Nancy Shepherd Hughes, whose work is familiar to many of you, many years ago, she researched the effects of rumors about organ theft, particularly in Latin America, in the favelas of Sao Paulo and Rio de Janeiro, Brazil, and elsewhere, in which ordinary Brazilians would fear going to the hospital because they believed that the hospital might try and kill them and take their organs or things like that. So you have populations that are already at risk for a variety of things, who are not wanting to go to the hospital for possibly preventable diseases and accidents and injuries out of this unfounded fear. And of course, Patricia Turner wrote Heard It Through the Grapevine, discusses rumors and legends in the African American community as well. And more recently, there was, in fact, just last month, there were attacks in Guatemala on nurses trying to give out vaccinations. There were anti-vaccine residents in rural Guatemala actually held hostage for about 7 or 8 hours a group of nurses that were just doing their jobs. And part of the reason was because rumors circulated on social media that they were actually trying to do harm. So again, there are very real consequences to some of these beliefs. And then the question comes up, well, who knew? And this is one thing that I, and I'm sure many folklorists, sort of roll our eyes at, right? Because often these are treated in social media and in news media as if, well, this is a surprise. No, this is not a surprise at all. Here's a quick interview with MSNBC's Ali Bauchi, who interviewed Francis Collins, the outgoing NIH director. And when he was asked, how could public health officials have done things differently, he says, well, looking back, I think we underestimated the vaccine hesitancy issue. I wish we had somehow seen that coming and come up with some kind of a myth buster approach to try and block all the misinformation. Yeah, Francis, yeah. You should have talked to folklorists. We could have helped you out on this. This is kind of what we do. Public health officials and pundits may have underestimated anti-vax hesitancy, but I didn't. Andrea Kidd didn't. He didn't. It's just, this is, again, when you approach it from a different discipline, you recognize that in fact this is part and parcel. It was entirely predictable. But unfortunately, nobody thought to bring them to the table and try and get their input into how to look at this. So in collaboration with Dartmouth College, I began a project looking for ways to help bridge the gaps between folklorists and journalists and epidemiologists and public health officials to try and find ways to sort of make actionable the knowledge and wisdom that folklorists have about how narratives circulate, particularly narratives about medical misinformation, rumors and conspiracy theories and so on. So my research had two parts. The first one was a literature search, which in fact didn't give me much, partly because a lot of the information is siloed. I found lots and lots of information on rumors, conspiracies, or medical misinformation, but there was no crossover. It was all very, very sort of marginal and sort of tangentially related. And then the second part was to actually interview experts in the field and ask them and say, okay, you do this, these are what you're doing. Tell us what you think is going to be useful for this. So again, I brought in epidemiology, journalism, folklore, medical anthropology, and information science, among others. I'm gonna sort of go over this real quickly, just to sort of give you a sense of what it was. I interviewed Sarah Gorman, who's a public health specialist, Don Sawatsky, who is the director of operations for a nonprofit group called Under the Same Sun, which helps people with albinism, particularly in East Africa, who were attacked, in some cases killed, and ostracized because of the belief that that having albinism is a curse or things like that. Henrik Olander, who many of you will recognize, he's an expert crisis communication specialist in Sweden. Tim Tangerlini, professor of folklore at UCLA. Charlotte Baker, senior lecturer at Lancaster University, who's done research on disability narratives in Africa. Malcolm Callanan, another professor of medical sociology at Kent. And finally, Ayobama Ufeleji, a Dartmouth-trained physician who comes from Nigeria and has established an NGO to fight these things. So again, I'm just going to sort of give you an overview of some of the themes that emerged from this. Most of the experts highlighted the need for public health officials to engage with other disciplines. This was sort of across the board. Everyone said, why are they going into this alone? Why aren't they bringing in more disciplines? And so I think part of the problem is there's an institutional inertia, right? People, they have their own domains and they think they know what's going on. And they're like, well, you don't understand what we do. And the problem, and that may be true to some extent, the reason that people don't understand what they do is, number one, because they're not explaining to other people what they do and the relevance of their research to what other people do for the common good. For example, Gorman is explicit about the problem of siloed expertise and the importance of not alienating stakeholders. For example, the news media and social media are, of course, powerful drivers of information, rumors, narratives, and so on. And they can, and oftentimes, of course, they're blamed, rightly so, for spreading these things. But they can also, of course, be part of the solution. Because if it can spread misinformation, then it can also spread correcting information. Another theme that emerged was the importance of being proactive. Over and over again, I talk to people and they're saying, you need to set this up ahead of time. Olander, for example, he does emergency messaging, and he was especially highlighting the fact that you can't wait until the last minute. You have to prepare these things. And so ideally, public health organizations such as the WHO, the NIH, and others would have in place a program that brings together many disciplines, including folklorists, on staff or on contract, so that when these pandemics emerge, there's a pre-existing template, there's a framework through which we can address these things, instead of everything's going to hell, what's going on, people are dying, let's try and scramble this together. Another key theme was the importance of multidisciplinary approaches. As I mentioned before, particularly when you're talking about medical misinformation, these things often circulate, not always, but often circulate in the form of narratives, as we all know. And if you're ignoring the narratives, if you don't recognize the value of tracking the narratives, then you're going to miss out on a lot of the information. And also the importance of storytelling and folklore in educational outreach. A lot of the information that's put out there in public health officials and by public health officials and organizations, it's just sort of factual nuggets, it's statistics, which can be useful sometimes, but as folklorists know, you're going to get much more traction if you frame it in a narrative context. You frame it in a way that mimics urban legend transmission, things like that. So again, these are other ways that they can be engaged. And so for the last part of my talk, I want to sort of briefly go over an overview of how public health can be viewed through a folkloric prism. Now, to some of you, this will be obvious, but I think it's good to sort of reiterate these things and to bring in a particular focus. So, for example, Andrea Kita in Vaccinations and Public Concern History, she says contamination legends fall into 5 categories: vaccines that cause the disease that are supposed to prevent, vaccines that cause additional diseases, chemicals and other unnatural ingredients, natural ingredients that do not belong in vaccines, and improperly stored vaccines. And then she says there are other narratives that suggest the intentional spread of pathogens. And we saw this in plague spreading rumors, for example, that circulated in Europe and elsewhere. And so the point here is that folklore-informed public health workers can make use of exactly these sorts of analyses to predict and prevent medical misinformation. Just another example, Diane Goldstein in Once Upon a Virus. She like others, including John Lee and Tim Tangerlini, drew very clear parallels between folklore and epidemiology. She says epidemiologists and general public alike have become obsessed with story making. While members of the public engage in rumors about who has the disease, places and people to avoid, mandatory quarantines, and so on, epidemiologists create and recreate plots that they hope will establish links of transmission. And you get into issues of the themes that emerge in these rumors, conspiracies of otherness and intentional transmission, and of course distrust of authorities and so on. And so at the end of the day, neither folklorists nor public officials, health officials, can eradicate rumors or medical misinformation. That's not, you can maybe isolate specific examples and debunk it for certain people in certain populations, but of course there is no magic wand that any of us can do. The real problem here is that the goal of doing this falls through the gaps, and the job of whose job this is often sort of gets left on the wayside. Doctors, for example, don't see public education per se as their job. They say, my job is treating patients. Somebody comes to me with a disease, a broken foot, whatever else, I treat the patient, they go on. So doctors themselves don't see their jobs as being, as part of their job is debunking or mitigating rumors or conspiracy theories. And folklore as well has often been focused on the descriptive rather than prescriptive efforts. So folklore for most of my engagement in it, not always, but often has been like, we describe this, we study the transmission, but there's not as much thought given to some of the harms that it might do and how to mitigate it. Jeannie Banks Thomas gave a great talk earlier this year on the SLAP test, in which she talked about ways for ordinary people, including folklorists, to sort of use a four-step process to identify misinformation. So that's one step towards that. And of course, the ISCLR devoted a special issue of its journal Contemporary Legend to COVID-19, as you all know. And in the introduction, Andrea and Ian note that being a folklorist during the pandemic, quote, has proved to be especially challenging, as we are often asked to debunk in crisp, true-false statements, not to provide a more nuanced critique of the current situation. As folklorists and legend scholars in particular, we are uniquely able to recognize immediately the patterns of contemporary legends and quickly provide a critique of them in real time, placing the legends within the longer arch of legend history. And I think that the next part is especially important. They say, instead of the "that's not what folklorists do" approach, so commonly used by many of us, we would advocate for a "yes and" approach. While engagement with non-folklorists can be challenging, it is possible and necessary, and we need to acknowledge that work as some of the real work of the discipline. And I'll just give one other quick example from John Lee, who talks in his book, An Epidemic of Rumors. He says, in terms of distinguishing and parsing out the different roles that folklore and medical anthropologists and epidemiologists have during pandemics, he says a folklorist may begin to offer answers that a doctor cannot, for while the latter offers a skill set that focuses on treating and preventing disease. The former brings an interviewee-centered approach primarily concerned with attempting to understand how the world looks through the eyes of the people who experience that world. These theoretical stances can in fact function well together. Medicine can tell us how to transplant an organ. Folklore can tell us why ethnic groups such as the Hmong often refuse such life-saving procedures since they view the organs as the seat of the soul, and what may be done to deal in such situations. So I'm almost done. I'm going to wrap up in a few minutes here, but I would just want to add the one particularly insightful possible solution that emerged from my research was talking to Tim Tangerlini, who again is familiar to many of you. And I interviewed him a few weeks back, and he said, well, you know, one thing that we can do is that if frontline workers, nurses, clinicians, and so on, were trained as being part-time ethnographers and folklorists, then they could collect information about the beliefs of the patients that they serve. And so talk to your patients. This is part of providing good care. And no one's expecting overworked nurses and doctors to suddenly become well-trained folklorists and tracking tracking and identifying different rumors and themes and motifs and legends. But there's a much lower baseline in which public health in the field people out trying to vaccinate people doing various things out, not in the ivory towers of academia, but out there in the fields working with people who the population they're trying to help. If they hear them bring up questions about misinformation or rumors, conspiracy theories, they can either sort of try and explain those away, or better yet, track them in the same way that disease surveillance does using epidemiology networks. And so the question then becomes, well, isn't this already being done, right? I mean, because this is not new. Their diseases have been around forever, and people have been trying to ameliorate them forever. And the answer to the question is yes, but. So there are agencies, particularly within public health agencies, organizations that are trying to do this. For example, the CDC, disease control, has what's called the epidemic intelligence. Who try and counteract misinformation. The WHO has what's called the TIP program, the TIP, tailoring immunization programs, that try and take into account the beliefs and attitudes about the population, so that they can then tailor the messaging. So there's a little bit done here. So it's not as if public health officials haven't heard about this. But the problem is that there remains this information gap. There remains this gap between the disciplines. And so it's a case of like, well, it's not my job, right? You go to the epidemiologist, they say it's not my job. You go to the folklorist, they say it's not my job. Whose job is it, right? People are dying here. The harm is real, and we see this in vaccine hesitancy. We see this in polio workers in Pakistan being killed. We see that there's real consequences here. And in writing in bioethics, Thomas May notes that neither scientists nor journalists regard their role as one of educating the public in a straightforward sense. Scientists, as I mentioned, are normally focused on discrete facts about specific phenomena rather than the broad social relevance. And to end, I want to give an example of a recent attempt at bringing these together. So this is a recent, I think this is from maybe 2 months ago, an article in the, I think it was JAMA, and it says, the title is "The COVID-19 Infodemic, Applying the Epidemiological Model to Counter Misinformation." And it says, quote, medical professionals and patients are facing both a pandemic and an infodemic, the first caused by SARS-CoV-2, and the second by misinformation, disinformation. And this is a great start. It's wonderful to see this published in a mainstream medical journal. However, if you read through the article, as I did, there are zero references to folklore. It's not, they even when they're talking about the importance of addressing misinformation, the notion that folklore may help to inform this doesn't seem to have emerged here. So looking ahead, the goals that I would have would be to use the current and, as I mentioned, long overdue recognition of medical misinformation as a public health threat to spur action. As I said before, this has been recognized for a long time, but it's never so widely acknowledged and in such high profile. You've got the Surgeon General saying this is a problem. You got the head of the WHO saying this is a problem. And so finally, people around the world and throughout many disciplines are recognizing this is in fact a problem. So then the idea would be to work toward building an interdisciplinary team that uses folklore, anthropology, and ethnology as part of the messaging process, both top down and bottom up, to try and better address and mitigate medical misinformation, particularly that can harm people. So the TLDR, the too long didn't read, the sorry Ben, I fell asleep to tell me what you just said, is that public health officials and folklorists can learn a lot from each other, and the best approaches are interdisciplinary. And with that, I will turn everything to Theo. Thank you.
Thank you very much, Ben. That was very insightful and stimulating, interesting. And I see that Greg Kelly has a question for you. Greg, or is it just applause?
He's applauding.
Okay.
I'm applauding.
Yeah, wonderful.
I will take your applause. Thank you very much.
Right, right.
Okay, I don't see any questions in the chat, but I have a general question, and that, well, as me being a folklorist, explaining how things should be understood, I get confronted with people saying, yeah, but you are just an agent of the government. You are just a secret agent spreading misinformation yourself. You are fake news. So what can we do really concrete against these reactions?
Yeah, that's a great question. As somebody who's been accused of taking shillbucks for going on 2 decades now, I mean, as you know, I write about conspiracy theories, false flag operations across the board, and exactly as you point out, naturally, when I try and debunk information, even using clear evidence and whatever else, you're going to get some people, often trolls, who say, "Well, yeah, but you can, you're just part of the conspiracy." And of course, there's no easy magic bullet to this. I think one of the best approaches is to point out to them, say, look, this is what I do. Like what you're talking about, it's folklore, it's narrative, and this is what we do. And I think that's part of the problem is that I mean, if you point out the background, if you point out the framework through which this is being examined, then people will sort of say, they may not agree with you, but they'll say, okay, well, I can see why you might think that, right? And so instead, if you just emerge out of the blue and say, this isn't true, and they say, well, who are you? Were you paid by the CIA to? I'm like, no, I've done this for 20 years. Here's the books I've done, and at that point, they have to either acknowledge that either you've been on the Shieldbucks payroll for 50 years, or you might actually have a point, and the disagreement is not one of disagreement isn't one of malicious intent or intentional deception, is instead looking at the same problem through different prisms. So that's the best advice I would have.
Okay, Jen, then one other question or remark pops up. Bill Ellis once wrote about anti-legends, humorous legends, legends mocking the conspiracy theories, for instance. Do you have the impression that they work this time? I've seen a lot of funny memes about conspiracy theories, but they are not, they don't seem to work in this matter.
Yeah, no, that's an excellent question. That really is good. And I had thought about Bill's example, the anti-legend. I think the other, and forgive me, I'm forgetting the person's name, but he does a lot on the welfare queen. He spoke.
Yeah, I know.
That's Tom Mould. Tom Mould.
Yeah, Tom Mould. Yeah, I mean he's done great stuff on that. So that would be a model that we might be able to. In fact, I think it was ISCLR conference. I think earlier this year, last year. So I think it works it works sometimes. It would be interesting to sort of parse out the evidence behind it, because of course, you know, it's easy to mock these people, right? I mean, it's to mock the beliefs. You know, you have people who are, yeah, and we see this all the time on social media. We see, you know, cartoons and caricatures of somebody who is anti-vax. They're, you know, and they're, you know, they're not afraid of anything, but then they're afraid of a needle, right? Yeah. And so it's an interesting angle, and I definitely think it should be sort of modeled and possibly brought into it. How effective is it? I don't know. You know, anytime that you're framing these narratives in humor, it can cut both ways, right? Because depending on how, as we know, how people perceive something has a lot to do with the take-home message. So I've seen memes and images that are being liked and shared by different people who I know for a fact have diametrically opposed points of view. Okay. It's because they're both seeing, they're taking what they want to out of it. And so you have this ambiguous messaging in some cases where both sides are saying, yeah, I'm like, hold on, one of you is missing the point here.
Greg. Yes.
I do have a question now. Okay. So, or a comment. So what I think plays into this, when you think about like what can some of these kind of outrageous views really be parodied? I don't know if you know the Poe effect, but the Poe effect is the more outrageous, and I'm sure you know this, Ben. So the more outrageous a view is, the more difficult it is to satire it. Because people don't know that it's satire, because it's so outrageous, you can't really outdo it in terms of its satire. So some of these positions on the public health issues are they're so conspiratorial, so outrageous. You try to poke fun at them, and it just looks like you're just throwing in with them, right? So it gets difficult that way.
Yeah, it's tricky. That's a great idea, and I'm going to incorporate that into my piece. So thank you.
Okay, thank you. I think that we need to move on. If people still have questions for Ben, then please put them in the chat.